everybody. I just want to make a video. This is my first video. I had surgery with Dr. Medalie in Cleveland. He did a great job. He's a super nice guy. The only complication I had was I have a seroma on this side. I'll show you. You can't really tell much, but it's kind of right here. I had it drained twice. Other than that, nothing, no complications. I'm 5 weeks, by the way, and I've been wearing the vest that he gave me for a little extra time. He told me about 2 weeks. I'm wearing it extra time to kind of compress that area where the seroma was. If you look, if I push on it, you can see where there kind of was some extra, you know, as opposed to the other side. My scar lines are super thin. They look thicker on here than they really are, which I'm happy about. They may stretch because I'm itching to work out again, dude. I was on a 100 push-ups program before I had my surgery, and I actually am not on hormones, if any of you are wondering. I just was lucky enough to have a moderately deep voice. I don't really grow like a beard or anything. I get some like chin nonsense, you know. I go on hormones though in January. I have an appointment. I know it's kind of backwards to do surgery first and then hormones after, but I was just lucky enough to have a moderately deep voice enough to pass. Anyways, here's another look. I'm really happy, you know, with the nipples and everything. I used to be significantly heavier, so I kind of had some excess skin on the side where he does liposuction. But now, I wouldn't say dog ears, a little bit of like just saggage, but that's to be expected. And I've been massaging the scars, and I noticed that they're not as raised up after doing that for the last week or so, or 2 weeks. And that's really it. I just wanted to provide any information I could. You know, before I did the surgery, I looked mainly on YouTube for tips and you know, stuff like that to see how everyone else was doing healing, what to expect. And he told me seromas aren't super common, but it did happen. I had to have it drained twice, right here. But I'm super happy, and I'm excited to start working out again, start building. You know, this is after 6 weeks of not working out at all, lifting at all, and it's kind of getting to me. But anyways, let me know if you have any questions. I'm happy to answer them. And good luck to anybody out there looking to get it. I definitely recommend Dr. Medalie. I noticed that Dr. Garamoni does, he seems to maybe pull it tighter, almost like so that it kind of goes over that muscle. Dr. Medalie sort of just kind of leaves the fat that's up top kind of in this area originally. And I mean, it seems like Dr. Garamoni's patients have more pectoral definition. Just, it seems like maybe he pulls it tighter, but Dr. Medalie did a great job. I'm really happy. One thing I did also want to mention is I live in Springfield, Illinois, and I went to see Dr. Kenneth Stein in Chicago. I only went to see him because after I talked to him, it was pretty clear that he doesn't do the same procedures. He doesn't do double incisions. He calls it apron flap. And I saw some of the pictures of his last patients who had this, and I just feel bad for them. He's awful. I mean, he looks just terrible, like almost mutilated. The nipples, the areolas are like weird shapes, not even round. I don't know. I wouldn't go to him if I were you. If you're interested in going to him, looking at him at all, it's not great. But Dr. Medalie he was about a 9-hour drive from here, and I was lucky enough to have my mom take me. So anyway, I just wanted to mention that he's not great. We wasted our time definitely going to him and even seeing him at all. So anyways, there it is, 5 weeks. I'm really excited to start lifting again, and let me know if you have any questions.